So today we're going to talk about occupational nursing, which is a field of nursing that a lot of you may have never heard of, just like we had never really heard of it when we started researching it. So it's a very interesting field, and maybe it's a field that one day you'll want to make your career. So the goal of our presentation today is to educate you on what an occupational nurse is, what it does, and then we even have a skit that you get to see occupational nurses in action. So our group was myself, Andrew Langley, Carrie, Emily Hunt, Jess Jones, Nicole Musel, Savannah Glover, and Sierra Holland. So yeah, let's get started. So first of all, what is an occupational nurse? Well, by definition, an occupational nurse can work in a variety of settings, including hospitals, clinics, and outpatient centers for corporations or state and federal governments. In a little bit simpler terms, basically, an occupational nurse is like a school nurse, but for the workplace. So, if that makes it a little bit easier for you to understand. Some tasks and skills of the occupational nurses, they assess the safety of the workplace, so they look for hazards that can cause problems or injuries. They educate employers and employees on medical diagnoses, so say an employee gets diagnosed with diabetes, they might be there to help that employee learn how to care for themselves. They document injuries and illness related to the workplace for things like workers' comp. They evaluate the occupational and medical history of employees to make sure that they're fit to do this job. And they can describe the responses to different exposures in the workplace. So they can do things like say, well, if they get exposed to this, then this could happen. They also respond to medical emergencies in the workplace. So now let's talk about the education it takes to become an occupational nurse. First of all, you have to become a registered nurse or an RN. And you can do that one of two ways. You can do a bachelor's degree, which is a BSN, and that's 4 years, or an associate's degree, which is a 2-year degree. The master's degree is also recommended, and they recommend having that in public health, business, or advanced practice, all which of those make perfect sense because you're dealing with public health rather than a doctor's office, and business because you may be responsible for keeping up your own records. Some experience that's also preferred in the area of occupational nursing is community health, which would be like a health department or free clinic, ambulatory care, which is a walk-in clinic, critical care such as ICU, and emergency nursing, which is ER. And that's so that way when you have an emergency in the workplace, you can respond better. So now let's talk about the important thing, salary. Just kidding, just kidding. So the median occupational health nurse salary is $71,441 per year. Now that's just an average. The lowest 10% earn $57,623 and the highest earn $86,538. So keep in mind that can vary a lot. So a lot of it depends on where you work and things like that. So one of the ways that you can have different salaries is, say you're working for a level 1 trauma center like Mission Hospital in Asheville compared to Harris Regional here in Silva. There's going to be a pretty good salary difference there. Nurses also have higher salaries when they work for major corporations instead of hospitals because those corporations can afford to pay them more. Experience and whether you have any occupational health nurse certification can also make the salary go up, just like in any job if you have experience. Whether you're an RN or a BSN can help, or even an MSN. And your geographic area, so a poorer region wouldn't have the same resources as a more well-off region would. And now, since everybody wants to make more money, let's talk about ways you can advance your salary. The main way is to get an even higher education than a 4-year degree. So that could be a master's, which is an MSN, or become a nurse practitioner, or become a DPN, which is a doctor of nurse practice. So that is actually a new program that will be starting soon here at WCU, and you can see the nursing professors if you have any questions about it. And now finally, let's talk about the work schedule. So typically it's Monday through Friday, but it can change depending on several factors. The company you work for, so if they're open on weekends, you may be assigned to weekends. the shift you're assigned, so whether there's first, second, third shift or just one shift, depends on, which shift you'll be assigned to. And then also whether there's on-call rotations. So say one of you just have to be on call on the weekends or whatever, that can also affect it. So we hope you've learned a little bit about occupational nurses in our PowerPoint. So now let's go to live video where we have two of our group participants interviewing occupational nurses, and maybe we'll even get to see what they do.
Good morning. Today Nicole and Jess are with two occupational nurses, Emily and Sierra. They're going to be answering a few questions for us in regarding to what it means to be a fully occupational nurse.
What exactly is an occupational nurse?
A certified occupational health nurse is responsible for the health and safety of workers in a number of industries. They are normally employed by corporations.
We perform a wide variety of tasks such as observing the work environment, educating employees about different medical diagnoses, looking at their workplace and identifying potential exposures and hazards, and responding to workplace medical emergencies, and many, many more.
In other words, we work to minimize health and injury risks for workers in various industries.
We have additional specialized training and education in preventing the negative health effects of hazardous work environments from affecting employees.
So what does one have to do to become an occupational nurse?
Well, to become an occupational health nurse, you will first need to become a registered nurse. This involves earning your nursing degree or diploma from an accredited nursing school. You will also need to pass the National Council Licensure Examination for registered nurses. In order to do that, you must complete 3,000 hours of occupational health experience.
Occupational nurses may be registered nurses who have associate's degree or bachelor's degree in nursing, but they may also be nurse practitioners who have earned a master's degree as well.
So what type of salary does an occupational nurse receive?
I believe on average an occupational nurse receives about $82,070.
So what are the typical work conditions of an occupational nurse?
Occupational health nurses work in manufacturing and production facilities, hospitals, and medical centers, as well as in other employment sectors, including government.
Workplace activities might include health and wellness, case management, ergonomics, workplace safety, infection control, disaster preparedness, and others such as travel health.
The work schedule is typically Monday through Friday, but many may vary depending on the work environment, position, and responsibility.
I really hate to interrupt, but Andrew just fell in the stairwell and he really needs help.
Andrew, are you okay? Do you have any head, neck, or back injury? Do you feel nauseous or dizzy?
Yeah,
Are you having trouble breathing?
a little bit.
Breathe in. Breathe out.
Did any of that hurt?
Yeah.
Should I call him?
You should call. So Andrew has some light swelling on his brain, and he's feeling a little bit nauseous and dizzy. So we're gonna call the paramedics and take him to the hospital for a CT scan to see if there's serious injuries to his brain.
Andrew, are you on any medications at the moment?
No.
Okay, the paramedics will be here shortly, and they're gonna take Andrew to the hospital.
What we as occupational nurses do on a day-to-day basis. It's time for us to get back to work now.
1 week later.
So I brought y'all my doctor's note today, and I'm ready to get back to work.
Okay, are you having any more symptoms or anything?
Not that I really know of. What should I be looking for?
Have you had a headache, any dizziness, nausea, vomiting?
I don't think so. I mean, a little bit, but it's nothing much.
Have you been taking your prescribed medications?
Yeah, I didn't really get any from the hospital. They just, told me to go home and rest.
Okay. Have you been staying away from bright lights, computer screens?
Yeah.
Okay. And you said you haven't experienced any headaches?
No.
Any swelling?
No.
All right, so it looks like this is all clear, and we're gonna let you get back to work here. Just let us know if anything changes in your health, any dizziness, headaches, vomiting, like we said.
Bye.
See you on Monday.